I had an ulcer that I had on the side of my tongue that kept coming and going. But it was only there for sort of a couple of weeks and then disappeared for a month or two and then came back and then kept going. Looking back now, it was probably more evident with everything I know, but at the time, just an ulcer that kept coming and going. So I went to the dentist I think it was just a regular checkup, but my regular dentist was sick. So I saw a standing dentist who just happened to be his wife, and she'd been retired for 2 or 3 years and came back to the practice that day. She had a briefing with the practice manager in the morning and was told about Mouth Cancer Awareness Week, which just happened to be the first day of Mouth Cancer Awareness Week. And I was a first patient. She looked at my mouth, saw that I had a scar rather than an actual ulcer at that time, and said, we're going to have to refer you up to the hospital because we've got to refer so many patients this week because it's Mouth Cancer Awareness Week. And I took that fine, filling quotas, whatever. I go. Went to hospital a few days later, about a week. Saw a registrar there who said, I don't know why you've been referred up here. Don't worry about it. It'll be fine. We'll do a biopsy anyway while you're here. And then 5 days later, I walked into a room full of doctors, and that's when I realised that it probably was something. It's a bit of a weird situation, really, because it's not what I expected. So I walked into that room thinking that everything was fine. And it was only when I saw everybody in there, as soon as I sort of opened the door and walked in and expecting to see, a doctor, maybe a nurse, maybe a trainee, and there being like 15 people, it was like, right, okay, something's not quite right. And I remember Austin, who's my consultant, saying 99 times out of 100, 999 times out of 1,000, it's nothing. But unfortunately, you're in the one that it is. And everything after that is pretty much sort of a blur of words. I can't remember everything that was said or everything that was discussed. And I think I was a bit numb to it. And I think I felt quite numb to it right up until the point when I went in for my surgery, for the day before my surgery when I was in overnight. And that's, I think, the first point when I actually sort of sat down and realised that I'd got cancer. And yeah, it was hard. Not knowing, it's the uncertainty, not knowing what's going to happen. And right down to, living or dying is one thing, but not knowing, am I going to be able to speak? Am I going to be able to eat? Is the meal that I've just had the last meal that I'll actually eat properly? Was that last conversation that I'm going to have with my normal voice? Things like that. Because it was on my tongue, so most of the mouth cancers that I dealt with to that point when I had mine, particularly at that hospital, were more sort of like gums or like side of mouth or palate and things. Tongue was not rare, but more uncommon at the time that I had it. So the conversations I had were very much, we aren't sure. This is what you could expect, but it could be worse, it could be better. But I was sort of briefed to, it might be a long time before you eat solid food. You might not be able to have conversations like you do now. Speech might be difficult. You might not be able to make the same sounds because your tongue's going to be different. I had a trachea as well, and that might stay, that might not. It depends on how your tongue reacts to everything. I was sort of set up for the worst case scenario, but with a great degree of uncertainty as to whether it would or it wouldn't happen. Dry mouth is fairly common because I had radiotherapy. So the saliva glands are just gone, pretty much. So I get dry mouth. Waking up in the morning is interesting sometimes when you wake up and everything's stuck together. But other than that, because I had a radical neck dissection and flap from my arm to replace part of my tongue. I have a lot of problems with my neck muscles and my shoulder muscles, which I'm on constant painkillers for. Physiotherapy, things like that and everything, but it's one of the side effects. And I have a awesome tan line when I go out in the sun and catch the sun because of the radiotherapy, which is a nice square across half of my face and my neck, which is but actual symptoms is just the pain on my shoulder, really, and my neck. When I had my cancer, I was told that because I was having chemotherapy and radiotherapy and everything, that I probably wouldn't want chemo. I wouldn't be able to have kids, and I've got 4 now, so that worked out quite well. But so they're all too young to remember it. But we talked to them about it, so they know, because they've asked about my scars and things like that. My partner at the time, who I'm no longer with, didn't handle it very well. I think it was a bit of a wake up call for like mortality of people around me. I think everybody, particularly my friend group, people my age, we were all very much like, we're going to live forever. Nothing can hurt us, sort of thing. I was only 27 when it happened. And yeah, I think it hit a lot of them and made them sort of kind of take stock and kind of go, well, actually, that could have been any of us, including my partner at the time. And my parents were the biggest thing. My dad's got a morbid fear of hospitals at the best of times. So he was having to come in and see me in hospital, and was sort of coming in, seeing me, and then going and having to sit in the corridor with his back against the wall because he nearly passed out every time he came in. So, but he was, well, him and my mum were very, yeah, I think they probably realised that they could have lost their son, which was, yeah. Having kids now, I understand what they went through. It's definitely better than it was 12, 13 years ago. I didn't, it sounds daft saying I didn't realise that mouth cancer was a thing. But when I got told, oh, you've got cancer in your tongue, it's like, well, that's not where you get cancer. Like, you know, skin cancer, yeah, fair enough, or like lung cancer and things. You can understand all that because all that's talked about and it's really, really out there. But mouth cancer wasn't really a thing. I mean, I said earlier about it being Mouth Cancer Awareness Week, the week I was diagnosed. Well, I only know that because I was told it because of that on my tongue. I didn't go in there thinking, oh, it's Mouth Cancer Awareness Week. There wasn't really anything around in the surgery or anywhere or on TV or anything like that. Awareness has definitely improved. As with probably all of it, there's probably still a long way for it to go. I think people, it's like you talk about ulcers and you had them for 3 weeks and got to get them checked out. And yeah, that's good, but actually there's other things as well that people can look out for, and I think more people know the better. I think it starts with sort of your oral health and your dentist and things like that, and actually having those conversations and having the experts, the dentist, talking to you about it. But you also recognising that actually if you've had an ulcer that comes and goes, well, mention it. There's no harm in just going to your mind, just taking a quick look. Something's not right, just have a quick look at it. But I think that extends to everything, not just your mouth. But yeah, I just think I think it starts with people visiting dentists and having those conversations, having those regular checks. I think if you go years without going and everything, then go, I've had this problem for 4 years, well, you've kind of missed the boat.